Good morning, sir. I am Romil M. Lagunday from BE Ed 2 Tab 52. And for today, I'll be having my teaching demo. Allow me to start. So, may I request everyone to please stand up and John, kindly lead us to prayer. Amen. Good morning, class. Good morning. So, before you sit down, I want you to pick up the pieces of paper under your chairs and arrange your chairs properly. Okay, you may now sit. So, before we proceed, who is absent in here? So, say present when your name is called. Okay, Labiaga, Melendez, sorry, okay, everyone is present. Let's clap our hands for every one of us. Now, who can still remember our lesson yesterday? Okay, can you raise your right hand if you want to answer? Okay, John. Precisely. Our lesson yesterday is all about communicable disease. Now, what are the common causes of communicable disease, Mark? Precisely. Now, I guess you are now ready for our new lesson this morning. But before we'll proceed to our main lesson, I want you to stand up and sing the action song that I prepared. So, assuming that everyone perform well in the motivational activities. Now, do you have any idea about our lesson this morning? Okay, a nice guess. Another hand. Very good. Now, let's proceed to our topic. I want you to know that our topic this morning is all about non-communicable disease. To start with, we have to know the objectives that you have expected to learn this morning. Everyone read the first objectives. Yes, we have to identify the common non-communicable disease. And for number 2, everyone read. Very good. Know the importance of having an active lifestyle as a prevention of NCDs or non-communicable disease. And for the third one, we have to demonstrate the symptoms and causes of the different NCDs or non-communicable disease. So, non-communicable disease is also known as lifestyle disease or chronic disease, and these diseases are not transmitted directly from one person to another. And non-communicable disease kills of about 41 million people every year, equivalent to 71% of total deaths globally. Now, that's it. Non-communicable disease kill about 41 million people each year, equivalent to 71% of all deaths globally. Now, this non-communicable disease, this non-communicable wait. So, these are the common causes of non-communicable disease. We have unhealthy foods, tobacco use or smoking, and third is physical inactivity, and lastly, we have alcoholic consumption. Now, this non-communicable disease have 4 types. We have cardiovascular disease, chronic respiratory disease, cancer, and diabetes. Now, let's proceed to cardiovascular disease. So, cardiovascular disease is a general term for conditions affecting the heart or blood vessels. Now, cardiovascular disease are heart attack. Second, we have stroke. Third, peripheral arterial disease that can be found in our legs. And third, we have congenital heart disease. Yeah, that's it. And these are the common signs and symptoms if you have um, cardiovascular disease. You, if you experience short of breath, severe pain in the chest, severe headache, unconsciousness, dropping face or arm, loss of strength, difficulty of seeing both eye, but if you see blurry something, and dizziness. So next we have the chronic respiratory disease or CRDS. CRDs are long-term disease of the airways and other structure of the lung. So, wait for a while. So, these are the common chronic respiratory diseases. We have asthma, chronic bronchitis, and that's it. So we have the signs and symptoms of chronic respiratory disease. We have shortness of breath, chronic cough, shortness of breath. Now we have the common causes of CRDS. So first we have smoking. Next we have air pollution and dust inhaled. So to prevent of CRDS, we have to stop smoking and stay away from secondhand smoke. So when we say secondhand smoker, you are the one who is not smoking, but you are close to a primary smoker. So for second, we have to eat a healthy and we have to maintain the balanced diet. Next is we have to maintain a healthy weight. So for the third, we have the diabetes. Diabetes is a chronic disease caused by low insulin production or poor use of insulin. So the common signs and symptoms of this diabetes is frequent urination, you always pee, increased thirst, you always thirsty, and then third is your increased appetite. So we have how we manage diabetes. So of course we have to exercise properly. And next we have to stop smoking, eat fruits and vegetables for a healthy diet, and reduce weight because it's trigger the diabetes when you are overweight. And then we have to take medication for the prevention of this diabetes. Now, for the cancer, we have cancer is the uncontrolled growth of cells in the body. It can spread to other parts and organs of the bodies. These are the common types of cancer: mouth cancer, lung cancer, breast cancer, liver cancer, stomach cancer, prostate cancer for male, and cervical cancer for female. Next, we have the common signs and symptoms of cancer. We have weight loss, fatigue, fever, change in skin, sore that don't heal, and bone tentacles pain. So these are the common causes, risk factors of cancer: unhealthy foods, tobacco use, smoking, physical inactive, um, alcoholic consumption. So that's all. So this non-communicable disease is the common cause of death globally. And this cancer, wait, for a while. So each non-communicable disease is the majority of this population that caused by this. So for cardiovascular disease, it's account from NCD's death of 17.9 people annually, followed by cancer, which is 9.3 million, and respiratory disease for about 4.1 million, and the diabetes is 1.5 million. Now, um, we can prevent this one by having a healthy lifestyle and avoid smoking, tobacco use, alcoholic beverages. You can take alcoholic beverages, but moderately. So overall, non-communicable disease can be cured and can be prevented. So I think that's all for this morning, and I am giving you now. I guess you are now ready for our quiz this morning. So I'm giving you 10 minutes to answer this question. This is multiple choice. Your time start now. So 3, 2, 1. Can you pass your paper in front? And thank you so much. So that's all for this morning, and yeah, that's it. Thank you for listening. That's all for my teaching demo this morning. Thank you.